So one of the main problems in HD is that as the disease progresses, the person kind of wastes away. You don't see any muscle mass; it becomes just skin and bones as time passes, because because of the movement, a lot of energy goes into it. You may not be a marathon runner, but sitting in one place, your muscles are constantly moving, and so that uses up a lot of energy. So it's important that a good calorific diet is given, and we have seen that patients who are able to manage that, they are able to maintain some muscle mass, and that definitely helps them to stay relatively well for a longer period of time. So controlling the diet and managing that, making sure that it is a well balanced diet with adequate protein and fat and carbohydrate is very important, because like I said, many of them find it difficult to, they may not relish the meal, and because of their movements, it is a very messy process of eating, so food is going to fall here and there. For them it is frustrating as the disease progresses, that they just can't take a spoon and put it into their mouth. So it has to be a very patient activity with caregiver and patient, and say that, okay, this is something I have to do so that I stay well for longer. So they have to take it as a challenge and say, okay, I'm going to eat slowly, but I'm going to do this. I will make sure that I finish whatever is there in this cup. So it is an effort on both sides for the caregivers to make it appetizing. Sometimes patient may be very unreasonable and ask for something which is not possible. So they're known to sometimes be very, what do you call, ziddi or persistent in whatever they say. And so some patience is required on the part of the caregiver to understand and be caring and say, yeah, please, this is what you can eat and it's good for you or whatever. Because you must understand, the caregiver here is often the only sole bread earner, or has to go to work or college, and therefore doesn't have all the time in the world to do this, and it is very, very, very stressful.